and welcome to the third talk of the Georgetown Urban Health Collaborative Spring Speaker Series. If you're new, I'm Bernard Liese, the chair of the Department of International Health. And I would also like to introduce my colleague, Rebecca Gribble. Together we run the Georgetown Urban Health Collaborative. The collaborative aims to address urban health challenges and employ social epidemiology and to get a better handle on these challenges here in the US and internationally. As I said, this is now the third speaker of this semester. Today, we are very pleased to welcome Olivia D'Aoust, who will speak about the impact, what else could it be, of COVID-19 on urban environments and how cities can respond and recover from the pandemic. Highly interesting topic. Olivia is an urban economist at the World Bank, works on the African Urban and Disaster Risk Management team, here based in Washington, DC. Olivia has focused on the drivers and the impediments to African cities' productivity and livability. Her work actually cuts across issues of economics, urbanization, conflict and fragility, and disasters. Olivia obtained her PhD in economics from the European Center for Advanced Research in Economics and Statistics at the Sorbonne Brussels School of Economics and Management, which is part of the Université Libre de Bruxelles, and holds a master's degree in economics and demography from the Université Catholique de Louvain. Welcome, Olivia. We are so happy to have you. Tell us everything about COVID and the cities.
Thank you. Can you hear me well?
Yes.
Perfect. And now I'm going to share my screen. What are the details here? Oh. This is watching. Voila. Thanks a lot for having me today. It's a pleasure to be presenting here for the Georgetown Urban Health Collaborative. I had a little experience in my earlier career on epidemiology in complex emergency settings. So it's a pleasure to be here today and to talk about hotspot of poverty and contagion and how the World Bank has been supporting cities to respond and recover from COVID. So as an introduction, so why did we start this work? We really wanted, when COVID hit, everybody was trying to do things and the urban, like it happened, like given the density of cities, it was a lot of attention turned to the World Bank Urban team. And so what we wanted is essentially see how we can help prioritize limited resources that would be developed for projects to respond. And where would be the emerging hotspot for COVID, where we could anticipate they would emerge, and as well as identifying vulnerable groups within cities. So we had like in a very short amount of time, we developed a simple tool, leveraging a partnership that we had in studying the future of cities. We really wanted to understand better, and here we mean as risk, essentially the inability to social distance, which is based on an adjusted measure of density, which really considers cities as a three-dimensional space. And that's the innovation into what we've been doing. And we also included the proximity to key services where people would move to and may gather around. And the second step was essentially from this rapid tool that was developed in partnership with the the German Aerospace Agency, which modeled building heights, and I'll explain in a minute why this is important. It's the three-dimensional aspects. We then kind of convey that into working with the teams, ground truthing what the model was predicting, complement it with local data, and responding to essentially project needs in a sense. So in different ways, so essentially it could inform where to invest in community level water and sanitation infrastructure, other infrastructure, where to prioritize the distribution of cash transfers, and also where would the pandemic risk be compounded with natural risk as the disaster season was starting. And then thinking a bit, and as we come now, I think beyond COVID, it really showed as well where to focus on in situ upgrading, urban regeneration programs where we could do public space, rental subsidies, affordable housing. I think a few of these emerge as the work advanced. So I was hoping we could present, so we are working on a platform for anyone to be able to use the input data and predict the hotspot. It's still in the works, so hopefully it's gonna come out soon. Let me just also tell you the story about why it matters to consider cities as three-dimensional. So when you consider building heights, New York, Manhattan, which is about the same density as Mumbai, has about 4 times the floor area. So that means that it shows the difference between overcrowding, which you have way too many people in each room or home, and density, which is a good thing and which brings cities all their benefits. So there's like a lot of debates on the future of cities and density, and all these concepts are convoluted in a sense. So it's really important to think about overcrowding is bad, but density is good, and it brings people together. It brings knowledge together. It brings agglomeration economies. It allows, and that debate over whether we will all work remotely from the countryside or a beach in the future, I'm wondering whether you would give up your bar in the corner or going to the restaurant with your friends. So that was a side note. So in what we did, so not everybody was allowed the luxury to self-isolate or social distance. So was it feasible everywhere? And that's really bringing the points of the need to understand the economic geography of cities. And so that's using the total floor area to construct a measure of density. As a country gets richer, cities are going to become taller because there is more investments that is going in. And that's really important to understand. Cities are not two-dimensional. You need to account for the available living space. And the risk of contagion is in the models that we ran is really defined as I said, place where social distancing cannot be met. It was really hard to bring a model at scale that would account pre-existing conditions, for example, in terms of health or age of the population. And so to be scaled up, and so we did that exercise for about 53 cities worldwide. And I'll come to some example. And essentially, the measure that we use is that you needed 3.5 square meters per person, and that's 0.29 people per square meter total floor area, and everything that is less than that was detected as a potential COVID contagion hotspot. So that's the reasoning behind the model, and the data sources that we used are global. So the World Population Database, which is publicly accessible. We've used the building heights that are modeled by the German Aerospace Center. These are still private. And then we also either crowdsources key public services from OpenStreetMap, and we did some complementary data collection in the cities where teams could, and also like tested a few things that I'm gonna come back to in a very, and this is a continuous effort. So I'll start with Kinshasa, which is a city in Congo, among the largest and poorest cities in Africa. And it's 13.7 million, according to the latest estimates. Nobody really knows. And there is, in Kinshasa, the poverty rate is 65%. So that's about 9 million poor people in one city. It's very, really reflects overcrowding and a very large relative presence of hotspots throughout the city, and in particular in the poorest areas. So we combine where people live in Kinshasa with the average height per pixel, and then it gets you the right map with the red points, which looks at the distribution of hotspot in the city. So it's very spread. The CBD, or the richest part, is where it's written Kinshasa on the top of the map. So it's you can clearly see that this is not a hotspot. Some hotspots are more crowded than others. So we also account for the intensity. And in some places in Kinshasa, and this is essentially the cell of the hotspot is a 100-meter square. So some are 30 times above the livable density. So the risk of in informing teams in Kinshasa. So in May last year, the DRC government launched a multi-sectoral response plan to COVID. It's 50 million, I think, dollars, and it aimed at launching an emergency cash transfer as a social safety net for the urban poor household, mainly to smooth consumption and prevent negative impacts from job loss, etc. So the project, so Kinshasa needed to identify 250,000 beneficiaries. There was no granular poverty map. There is no social registry. Usually social protection programs are disbursed in rural areas, so no pre-existing program. And so what we did essentially is bring analytics together to identify hotspots and to complement the hotspot with neighborhood characteristics. So we had a data sources from a survey that happened a few years back, which included high risk of flooding, building density and precariousness, and access to jobs. So what we did is essentially target the household or identify the household that would live in the most vulnerable and the most populated neighborhoods. And after that, we launched a call for firms and telecom companies to identify and profile customers. So in 4 zones that we identified, and de facto sending a bunch of text, bulk SMS messaging for beneficiary, which could then self-register and open mobile money accounts. And that would as well be the very onset of a register for the city. So essentially, we really took work as a World Bank group and bring these two together. So the second aspect of hotspot is where do services locate? So where are the key services? And this is information that we don't know, essentially, except like we know in the US, or I'm sure we know here, but where are like tap water, where are public toilets, where are markets, where are shops, where are bus stops? So we had an idea from OpenStreetMap, but very quickly we wanted to have a more comprehensive map. And so what we did is also leverage an initiative that's been running from the World Bank, which is the Geo-Enabling Initiative for Monitoring and Supervision, which trains essentially the project implementation units to monitor the projects that they are investing in. So very rapidly, we drafted a questionnaire and sent the team from the water projects into Kinshasa with guidelines on social distancing and paying attention to respecting the COVID guidelines. And then they looked at essentially the number of people using the service, whether there was soap or water available at water points and toilets, whether there was enough space to social distance, the frequency of the departure of buses. The same tool was used in Brazzaville, in the other Congo, at no cost, because it was like everything was set up. The team had been trained, and so that was very quick in implementing. And by June 12, we had that map that is shown on the right-hand side. Unfortunately, that has a downside, is that we don't know what we don't know. And so there might still be places which have services and into account. And so what we did is rerun the analysis a second time on that basis to account for not only mobility, but also clustering around these points. The second example, learning from Kinshasa, is Nairobi. So in Nairobi, what we did is refined a bit the questionnaire, because we saw that some questions were not really providing much information, and then did a sort of a task service. So it trained local data collector. So these were slum dwellers, and they received push notification for work opportunities, and were paid for each point they would map. So they would arrive in the design location and then gather data on the points of interest, collecting the same information. That was slightly more tailored. And we learned as well that, and it gave capacity. It did two things, essentially. It's helping the projects know where the services are, and it's also building capacity on digital skills for slum dwellers, in a sense. And so that was much more refined exercise. So we did that into, I don't know, a few slums in Nairobi, a few slums in Mombasa, and a few slums in Kisumu. And so what we found is that among the hotspot and rerunning the analysis, over the 10 millions of people living in Nairobi, 56% of them are in hotspot, which is 12% of the land area. And you can see zoom ins. And so this is the two slums in which they included more services are Kibera and Mathare. In Nairobi, what was also interesting is that there are hotspots detected in places that are not on the radar of the government, but that might need affordable housing, for example. So it's the segment of the population essentially that's not living in slum areas, but right on above that level of housing. And so the next step that we are looking at is taking street view pictures of buildings and houses to also help in ground truthing the heights, for example, and as well as looking at how we can use machine learning and remote sensing algorithm to qualify the quality of the building and to identify these areas for the government to intervene or for projects to invest in. As discussed before, at some point we thought it would be also useful to know and predict which are the places which would be both in floodplains or prone to flooding, as well as at risk of COVID or overcrowding. So that's 5%, but that seems like a low percentage, but if you convert it into absolute values, this is 400,000 people that are living in these places. The last places of our journey is Semarang in Indonesia, where a lot of the government had already put in place some data collection and they had incidents of COVID. They had a lot of information on the city. So it helped us essentially looking at who was the most affected. So this is not surprisingly much harder for the bottom 30% in Semarang to social distance. In that city, 25% of the population lives in high COVID contagion risk location, and that's only 6% of the built up area. And it's really concentrated in the places where poverty is higher. And then in Semarang, we brought tools together. So that's the government was already involved in targeting. And so they used Collab data, which is an app that's connecting communities to the local government response. And so people were asked questions on whether the interventions of the government was right or wrong, whether they targeted the right places, whether they did, one of the question was were also about shortages and where they were. They also had the spread and where COVID was spreading. So what we did is also that allowed us to confirm that the model was also predicting correctly in a sense. So it's really good. Like we are confident in the model because, but like looking at mapping the hotspot and the average daily incidence, there is clearly in Semarang, and then again 4 cluster of contagion risk. So we did a hotspot analysis, and that's also highlighted the severity of the hotspot based on what people were reporting on their phones. So that's bringing everything together in a single platform. So a few reflection is that we realized that the pandemic did resurface many of the existing challenges in cities. And that's including the chronic underinvestment in public spaces due to many reasons, from lack of funding, coordination among stakeholders, and low technical capacity. I think it's probably, woke us up and present, in a sense, a unique opportunity for cities to build long-lasting public infrastructure that will make cities more livable. We will see in the next 10 years how that proved to be true. Supporting government in their efforts to mitigate such risks to projects aiming to transform precarious settlements, which was already one of the World Bank goal, but like thinking more comprehensively in both physical and socially integrated interventions. And I think as for natural disaster, it could provide governments and society the opportunity to make durable changes. Thank you very much. And I think I'm under time.
That is perfectly fine, Olivia. Thank you so much for your really, I think, thought-provoking presentation. I would like to say, we talk a lot about what could happen in cities, but you talk about what one could do about it, how one could measure it, how one could use digital technology which is available, databases which are around to actually look at it, and to basically, what I could say, operationalize, or at least operationalize possibilities to deal with issues which otherwise are so complex and so overwhelming that we say, what am I going to do in a slum? We can't do anything. It's not true. I think that I find very impressive. And there's a big thank you to you and your colleagues who have been working on these issues. It's very important for the cities. I said already, putting digital technology at work, using cell phones, using basically databases. The governments have opportunities, and that is a very important dimension. The last point which you made at the end is, now we have the chance to really push these solutions. Now is the time to go forward and say, no, no, don't say me it can't be done. It can be done. Let's use the technologies, try it out. And I think I really have to congratulate you in the bank at your team for doing that. So with these comments, let us open it to questions and answers. Rebecca, you always are looking at issues and questions.
The first question that we have comes from Uva, and he says, I'm delighted to see your use of GIS in both analyzing cities and designing program investments. What are the current challenges associated with deploying geospatial tools in your work?
Should I take one by one, or?
Yeah, one by one.
As you want. Oh, lots of challenges. So I think it's looking at a problem and trying to find more than geospatial data, I think. So getting so one is essentially one is that people, like, surprisingly little people know about what the potential of geospatial data. People think it's like a world apart from what they've been doing. And I think also often we try to use them without, it's very easy to use them without knowing what we're looking at, in a sense, or without understanding what it tells you. And these global data sets have their limitations as well. So you cannot, these are produced and modeled at the global scale. And so when you get to zoom in a city like we did, I think you need to be careful as well and really back them up with data that has been collected, or ground truthing. And data to ground truth is really lacking, in a sense, because people think that geospatial data and the digital revolution is going to change how we do things. But I think both bringing the two together is really key to understand these issues as well. And I think the power of, we keep repeating that, but I think the power of maps, you bring map into like in front of someone, and they start understanding what why this place and these overlays. So if you have a school, for example, and a road, that everything is linked, in a sense, and that everything needs to be linked. So I think this is important for coordination and investment, and saying to governments, look, that's your slum. What can we do in that space, in a sense? But it's challenging.
I have a follow-up question on the geospatial, on the ground truthing. You were very lucky in a way that you had the team from Brazza being able to do the ground truthing in Kinshasa. Was that easy to organize? Would that be how would you organize it in different cities? How would cities organize that?
I think we had the luck in Kinshasa and in places we have the luxury of having so these two initiatives. So one is Open Cities, which has been working in cities, collecting, like having like a network of young people willing to learn this digital skill and willing to learn and map streets or points of interest or building, working with projects, implementing things. And that's one team that we could deploy their network in a sense. The other one is actually, so I've been working with the GEMS team a lot, the Geo Enabling and Monitoring for Evaluation Initiative. And I just thought, let's try it. You have nothing to lose in a sense. Ask them, and then I think they are very proactive as well, and they jumped on the ball. And then I think it's about knowing people that will at least try to do the job. And so very quickly, I recall they said, okay, let's draft a questionnaire. Let's make a manual, because of it's COVID, it's not easy. And let's see with the monitoring and evaluation of the water project. So the Kinshasa has a project in water as part of an urban and resilience project. And it's the person said yes, and then deployed his team. So not very hard. Semarang had everything in place in terms of data collection. So essentially it starts from foundations. And I think this is an important point to make, is that if the city or the country has the data foundation in place to start this kind of work, it's relatively easy because everything is in place. You just have to add one questionnaire or use one tool that exists and that people can use. But it's really about having the data foundation in place and treating that as the foundations of your work in a sense. In places where nothing was available, I think the success, that's why I think these are the three best examples. Other cities, we only had OpenStreetMap.
I see. And what was the response of the city administrations?
So in Indonesia, a great response, because we've used the city and like foundations. In Kinshasa, I guess it was more a response than they're more kind of taking everything you give them in a sense, capacity wise and I think willing wise. I'm not part of these teams, so I don't want to answer for them. And I think in Nairobi, it was also kind of successful. And I think the government and the team are really happy to pursue. Nairobi is the places in which we are continuing collecting data with the native firm organization and expanding. And I think in a few other cities, we're also working with Slum Dwellers International, also to make sure that we are not missing people. Or missing neighborhoods, so it's more ground truthing in a few cities as well.
Highly interesting. Rebecca, back to you.
I'm sorry, I'm just reading as soon as I click to speak.
I think Uwe had a question.
Yeah, I'm just quickly reading it. So Uwe says we are emerging from an emergency response period where we are responding to short-term human/community needs during the pandemic. There is a lot of speculation about the long-term impacts of the pandemics in established economies, but what about emerging market cities? What will be the longer-term impacts? Will the poor have no choice but to occupy high-risk locations in overcrowded conditions in the long term?
That's a great question. I think it all depends on what lessons the governments are taking, in a sense. But in general, the poor were living in high risk, not only COVID and health, but also kind of floods. That's a big theme that we are trying to understand better, is the trade-off between living closer to the city in cheap land where you are in crowded floodplain areas versus living very far at economic risk, in a sense. And I think this is a trade-off that only the poor are facing, and how to improve conditions and to put in place risk mitigation and prevention mechanism in terms of what you plan for your cities. And that's where the role of public space and improved connectivity is going to come, in a sense that if you decide that this is an area where people would be living at risk, then what can you do? A soccer field, that's something that you could invest in. And also all these emerging trends in investing in more friendly commuting, soft commuting transportation network, improving the connectivity within the cities, and things like that. I think if we manage to make that happen, I think this is going to be a big, but it's a big if for some countries and cities in the world.
I just wanted to ask a question with a little bit, I don't mean to be provocative at all, but
please.
The spring meetings are coming up, right, next week. So my question is there an agenda item? Is there a presentation? Is there interest in these issues, or is overall general economic?
I think well, I'm not part of the committee that's organizing this, but I'm pretty sure there will be. So a lot of them. So I've seen an email on the poverty and equity briefs, which essentially have looked at what's going to be the long-term economic impacts of the pandemic. I think what maybe is missing from these briefs is where, and that's bringing, where do poor people live in the city? Which are the neighborhoods that are going to face the most risk? But I think we'll, as every year, I think the spring meeting will address definitely. And I think what we also think is that a lot of sectors are going to lose traction or attention because a lot has shifted towards social protection and health versus the more structural, macro, and trade, for example. Education is likely to suffer. So I think it's going to be an interesting time to discuss with governments and mayors as well.
Highly interesting. Thank you.
Yeah.
Rebecca, back to you.
We have a question from Amelia, who asks, how are you specifically uplifting the voices of the people of color in the cities that you are looking at and providing this service for?
I'm not sure. So we looked much more, at least my part was to look at the neighborhoods, or the first layer of targeting, and then teams on the ground would make sure that. So one of the pillars from the recovery is inclusion. So we want to be resilient, inclusive, efficient, and sustainable rise for recovery from the pandemic. That's the message I think that's going to come up at the spring meeting. So I think inclusion is going to be a big part of that. And part of it is teams that are implementing projects, making sure that not only people of color, minorities, women are represented in the projects.
Thank you very much, Olivia. I'm looking whether there are other questions. Then, since, yeah, I think then we'll close this session. And I think you made a very important contribution, because these are practical interventions which can be done using existing, as you said, geospatial data. There will be a lot of support required on the urban front, and the willingness as well to change investment patterns in urban areas. There's no question about that. That's why I was asking for the spring meetings. But thank you so much for sharing your experience. We will be in contact with you as we go ahead.
Anytime.
These are practical ways of moving forward and identifying the poor and making an investment where it really matters. So a big thank you.
Thank you,
Rebecca, for the last word.
Thank you to, like, it's a team effort. So thanks for having me represent them all.